I'm Cassandra, and I work with ThedaCare. I'm also a busy mom of 3.
Camden, no thanks. Hey.
Doing it all is more challenging than ever, and that includes making healthcare decisions. So, welcome to Health Inspired Talk, where we cut through the confusion, we chat with experts, and we help you get the care you need for you and your family. It's hard to believe, but it's been 3 years since we opened the doors of ThedaCare Medical Center-Orthopedic Spine and Pain. The center brings together experts from ThedaCare and Neuroscience Group and is the region's only comprehensive hospital dedicated exclusively to orthopedic spine and pain care. A team of experts came together to help design the space and determine the best equipment and technology for the medical center, all toward the goal of providing patient-focused, efficient care for our communities. Throughout the past 3 years, we've seen success. As we mark this anniversary, we're sharing highlights from the past 3 years and exploring the care that our teams continue to provide at ThedaCare Medical Center-Orthopedic Spine and Pain and our other locations throughout Northeast and Central Wisconsin. Joining us first today is Dr. Erickson, a shoulder, sports medicine, and arthroscopic surgeon with ThedaCare. Dr. Erickson, welcome.
Glad to be here.
So you last joined us in July of 2022 before ThedaCare Medical Center Orthopedic Spine and Pain opened. What has this center meant to you and the teams and the patients over the last 3 years?
Well, first of all, it's incredibly gratifying. I think most importantly, patient experience has been amazing. Quality of care has been amazing. And we can even say that and then say the data, the metrics back it up. And so I'm very proud to be part of that group that is pushing that forward.
You can see the data you hear from these patients, right? That the experience is different for them.
100%. Before, care would be very scattered. Here it's very centered, focused. Everyone knows where everything is, and the experience. The patients talk about the experience. I think of the previous state to the past 3 years, it's apples and oranges in a good way.
That's wonderful. So in recent years, ThedaCare Orthopedic Care has continued to strive to find ways to better serve our patients and communities. Let's talk through some of those. When we began offering care here soon after the center opened, we've continued to increase access. So why is that so important to expand access for our patients and our communities?
It's very simple. I think all of us in society, we don't want to wait. And many times waiting can lead to maybe potential lesser care and potentially even the risk of harm. So having an access point, 7 days a week, is just critical for the weekend warrior, the 10-year-old that gets injured on the soccer field. They want to have some comfort that they're receiving care. They're not hoping to receive care in the future. And that entry point, walk-in clinic, then gets them marching towards their definitive care in a much more expedited fashion.
Let's talk a little bit about walk-in care. Originally that opened with sort of limited hours and it's expanded, there's more access. Why is walk-in care so important to kind of get people through the door?
It's meeting their need. It's quite simply just meeting their need. They want to know what's going on and they want a path. None of us like the unknown. Getting some level of known and a path and a strategy, I think that just is human nature of where we are in our society today.
Yeah, it makes them feel comforted, right?
Right.
Okay, so to help those suffering from various types of injuries, a few years ago we began offering these different types of seminars, back, knee, pain. What are some of the topics or tips that you want people to know kind of coming out of those seminars?
I think the important thing, we do that with multiple providers and having them understand there's different ways to enter the system, and there's different care. It's not all about surgery. It's just as important, the non-surgical component. What does benefit from surgery, what doesn't? You have access to whether it's myself, a surgeon, primary care sports medicine, a pain management provider, that people understand there's just a multitude of ways to care for things. It's not singular, it's individualized.
That's great. So throughout the past 3 years, ThedaCare Orthopedic Care has added many new physicians, advanced practice clinicians, really just adding people to the team. Why is that critical to meet the needs of the patient?
Well, in many ways, number one, access. You can't have a finite number of providers and think you're gonna have the same access. Number two, you always wanna be recruiting talented individuals, and many times those talented individuals bring a different, unique perspective and maybe a potential unique skill set that's gonna benefit the community. Collectively, we work as a team. And although you might see me, if I feel they have a diagnosis and the treatment's gonna be better served by one of my other specialist partners, we hand off patients in a very appropriate way to make sure they're getting maximized care.
That sounds great for the patient. When we last spoke with you, we talked about an uptick in pickleball injuries. That's what you were seeing from some of your patients. Is that still holding true?
It keeps going up and up and up. So yeah, the pickleball injury, the phenomenon is a never-ending increase in the number of patients that we see for it. And once again, I'm all for it because it's good physical activity, it's social in the community. It's just you probably can't talk to someone who doesn't play pickleball now. 20 years ago, you'd never see a pickleball injury. Now in the clinic weekly.
Okay, what are some maybe quick tips and advice for people who are playing pickleball to help keep them injury-free?
Diving headfirst for anything is not a good idea.
No go, okay.
Don't dive for that ball, let it pass, move on to the next point.
Next point, okay. Next point,
Simple,
next play.
But sometimes the competitive juices get flowing and people, regardless of age, cannot help themselves.
I feel that. Okay, that's a really good tip. Yeah. All right, finally, your focus areas are shoulder, sports medicine, and arthroscopic surgery. What do you see on the horizon for that type of care in the future?
There's a couple things I think about, and we do some of this now in very complex situations. The ability to make custom implants. I do see a world probably where something is getting 3D printed in the operating room. I think the other thing that all of us in all society wonder about, what is going to be the benefit of artificial intelligence in the care we deliver? Mm-hmm. Can we take enough data that we can't possibly organize or create an equation that could equal better care? There's so many variables they've taken into account that can supercomputing AI get us there and that we're delivering better care? My answer is I assume yes, but none of us know that time frame, that horizon, that trajectory. But I think that is where we're going.
That's exciting.
Very exciting.
Okay. All right, Dr. Erickson, thank you so much for being with us.
My pleasure.
Joining us next to discuss trends in joint replacement surgeries, Dr. David Liebelt, a hip and knee reconstruction specialist with ThedaCare. Dr. Liebelt, thanks for being with us.
Thank you for having me.
So Dr. Liebelt, we know that the need for joint replacements continues to increase. By 2030, the Arthritis Foundation says that they're going to see a 171% increase in hip replacements and a 189% jump in knee replacements. Do those statistics surprise you?
They don't surprise me. We've been expecting this trend for a long time as different demographics age and people are living longer and demand to be more active in their older age. Mm-hmm. We see these trends continuing.
Okay, and we are here and ready to serve those people. So to help us look ahead, like the Arthritis Foundation is doing, we're going to use a giant fortune teller. You probably remember this from elementary school. We'll do the thing here and it'll give us a fortune, and then we're hoping that you can explain what it might mean for patient care.
Okay.
All right, let's start. Go ahead and pick a color.
How about blue?
Blue. B-L-U-E. A number?
2.
2. 1, 2.
And let's do 5.
Number 5. All right, your body will know what to do. Strength will grow from within. What could that mean for a patient?
Well, I can tell you that joint replacement surgery has been dependent for years on implants being cemented into the bone. Now, more and more implants are being designed to be implanted into the bone and for the bone to grow into the implant. We call that technology press-fit technology. So if your bone has grown into the implant, what that should do is create a knee or hip replacement that lasts longer.
All right, next fortune here.
How about yellow?
Yellow. Y-E-L-L-O-W. And a number?
How about 1?
1. One more number.
And 3.
3. All right. Precision and progress are on your side. You are in good hands and robotic arms. Interesting.
Historically, hip and knee replacements are dependent on a surgeon making the right cuts, removing the worn out cartilage and bone, and then placing the correctly sized implant into the correct alignment in the body. Over time, instruments get better, measurements get better, surgeons get more experience, but now we're looking at a future where we're using robotic technology as another tool to help surgeons make better cuts and put the implants in a better position.
Does that cut down on recovery time as well for the patient?
Ideally, if the right size implant is put into the right place, the patient should have less pain and a faster recovery.
Wow, okay. Next one.
How about red?
Red, R-E-D.
And 2.
2, 1, 2. Another number.
And 1.
1. Let's see what we have here. Your path to recovery is smooth.
Yes, a smooth recovery is essential. So historically, knee or hip replacement would require a hospital stay. Patients could spend multiple days in the hospital trying to control pain and trying to mobilize. Now, surgeries for hip and knee replacements are routinely going home same day of surgery. Patients are walking or mobilizing hours after their procedure. And pain is less, recovery is smoother.
Okay. All right, give us another color.
How about blue?
Blue, B-L-U-E. And a number?
And 5.
5. 1, 2, 3, 4, 5. And a number?
And 8.
8. Your custom recovery awaits you, designed for comfort and built to last.
Well, I think as we just get better and better at making the implants and we get faster and faster recoveries, the only thing that remains in the future is what we leave the patient with as we leave the operating room. So right now we deliver pain medicine into the hip or knee as we leave surgery. I see a future where we can also deliver antibiotics or growth factors, other biological medicines that we create that could lead to a faster recovery, less pain, and better outcomes.
Dr. Liebelt, thanks so much for playing our game with us and providing those insights. Before we let you go, can you give us a glimpse of the future about the total joint replacement program at ThedaCare?
Yes, so at ThedaCare, we've been very successful at building one of the busiest hip and knee replacement programs in the state of Wisconsin. In the future, we look to increase access for patients and continually improve the quality and the outcomes that we see.
Thanks so much for being with us, Dr. Liebelt. So today we've talked a lot about ThedaCare Medical Center Orthopedic Spine and Pain, and at the same time, ThedaCare is dedicated to providing close-to-home care to the people and communities we serve. And that includes offering orthopedic care at locations throughout Northeast and Central Wisconsin. Dr. Brian Lohrbach, a general orthopedic surgeon, joined us in early 2025. He provides care in New London and Shawano, as well as Appleton. Let's hear from Dr. Lohrbach about the importance of providing care in our rural communities.
I think it's a great opportunity for somebody who has the experience that I have, that we can have somebody out there who can treat a broad spectrum of orthopedic problems, not just be focused on one particular area. I'm going to strive to try and keep as much of the patient population being treated in their own community, having to not have to send them out necessarily to Appleton or to other larger cities. And I was able to do that in New London for the past 21 years, and I think I can continue to do that for both my patients in New London as well as my new patients in Shawano. One of the statements you hear as an orthopedic surgeon, I'm sure all specialties hear it, but when somebody comes in and they thank you for giving them their life back. This is the life that they enjoyed having before they started having an arthritic hip pain or before they tore their rotator cuff. And you can get them back to doing the things they were doing before when they thought that would never be possible again. And I think that is really, truly quite satisfying to hear that from a patient.
Thanks for joining us for this episode of Health Inspire Talk. Our ThedaCare Orthopedic Care teams look forward to continuing to care for you. To schedule an appointment, call 920-831-5050 or visit ThedaCare.org/orthopedics. We'll see you next time. At ThedaCare, our mission is to help you live your unique best life. And we want to know what kind of questions you have when it comes to your health care. Leave your questions and comments below, and be sure to like and subscribe so you see the very latest in this series.